Clean and healthy teeth are important for our well-being. Oral health is primarily a matter of good oral hygiene, healthy eating and drinking habits, use of fluoride and regular dental checkups. In modern society, it's entirely possible for people to keep their own teeth throughout their lives. Teeth vary in size and shape. Incisors, canines, premolars, and molars. A tooth comprises two parts, crown and root. The crown is the visible part of the tooth, which projects into the oral cavity, while the root is the hidden part, which is rooted in the jawbone. The crown is surfaced in enamel, beneath which is dentine. The reddish area in the middle is known as pulp. Around the root is connective tissue, which attaches the tooth to the jawbone. The gums are pale pink in color and are tightly molded to the teeth. Hygiene is necessary to everyone, and clean teeth are no exception. The mouth contains bacteria which can damage teeth and gums. Certain bacteria attach themselves to the teeth to form plaque, a whitish film which adheres to the surface of the enamel. The more frequently sugary foods are eaten, the faster the plaque will form. Plaque must be removed regularly in order to prevent oral ailments such as dental decay and gingivitis, inflammation of the gums. Plaque, which is left on the teeth for a long time, absorbs minerals and forms dental calculus, tartar. Tartar contains germs which can cause irritation in the gums. It's important to allow plenty of time, 2 to 3 minutes, for brushing. Start, for instance, on the insides of the teeth, on the left. The brush hairs should be placed obliquely to the gums. Press on the brush with the hairs between the teeth and the gum line and rub away from the gums. Brush back and forth with short strokes. Then brush the biting surface of the molars, making sure to brush the fissures thoroughly to remove plaque. Continue to the outer surface of the molars and remember to brush thoroughly behind the back tooth. Brush the canine and incisor areas thoroughly. When the back of the incisors is brushed, the brush must be held vertically and moved up and down. Then continue with the other 3 sectors of the mouth. Use of a soft, dense brush and fluoride toothpaste is recommended. Do not rinse the mouth after brushing. The fluoride in the toothpaste will remain active for longer if the mouth is not rinsed. Swallowing a little toothpaste does no harm. Electric toothbrushes are useful for dental care, but must be used correctly. The brush is placed against the tooth surface and kept in the same place for about 3 seconds, following the curve of the tooth surface. Then the brush is moved to the next tooth and each tooth surface brushed outside, inside, and chewing surfaces. Floss should be used to clean between the teeth at least once a day. Cut a length of floss long enough to wind around the fingers, then carefully insert it between the teeth and down to the gap between teeth and gum. Pass the taut floss up and down on each side. The floss must be held firmly against the tooth surface throughout. Floss all the gaps between the teeth in the upper and lower jaw. If the gums bleed, this is a sign of inflammation, indicating that even better dental hygiene is required. Interdental brushes can be used to clean larger gaps between teeth and gums. They're also useful for cleaning around bridges and implants. Insert the interdental brush carefully and brush back and forth against the tooth surface 5 to 8 times.
Remember to floss every day.
Use of fluoride is recommended to prevent dental decay. Fluoride is the most important ingredient of toothpaste, and it affects the chemical processes which are constantly taking place in the dental surface. If there is sufficient fluoride in the mouth, it can contribute to recalcification and can reverse early-stage dental decay. Toothpaste should be applied to cover about 1/3 of the head of the toothbrush. The frequency and duration of fluoride being in contact with the teeth is important, so leave the toothpaste in the mouth. Do not rinse after brushing. Simply spit out the excess. Fluoride chewing gum can be used for people whose saliva production is limited, and also for anyone whose risk of dental decay is increased for any reason. Some diseases and medications, as well as dry mouth and poor diet, lead to increased risk of dental decay, and in such cases, it's advisable to increase fluoride use, for instance by rinsing the mouth regularly with a fluoride mouthwash.
Brush your teeth twice a day and use fluoride toothpaste. The fluoride remains active longer if the mouth is not rinsed, thereby strengthening your teeth.
Healthy eating and drinking habits are the basis of good dental health. Bacteria which adhere to the surface of the teeth transform sugars from food into acids, which release minerals from the teeth for about half an hour after sugary food is eaten. A person who is always nibbling at sweet foods and drinking acid drinks will always be in the red or pink sector of the scale, with an increased risk of dental decay and erosion of enamel. Saliva plays a key role in the body's defenses against dental disease. If the interval between meals is normal, the body's defenses can successfully resist acids and dental decay, and enamel erosion is controlled. A piece of cheese after a meal protects the teeth, and the same is true of sugar-free gum. Constant snacking is too much for the defensive system to cope with. Adequate saliva production is vital to well-being and maintains oral health through a neutral pH level. The saliva flows from salivary glands which are located in the floor of the mouth and in the cheeks. Dry mouth can be a side effect of certain diseases and medications. The symptoms are soreness of the mouth and difficulty in speaking, chewing and swallowing. Persistent dryness of the mouth leads to more and faster tooth decay. The incidence of problems with oral mucous membranes and gums also increases. Problems also often arise with the use of dentures. Good dental hygiene is always important, and even more so where the mouth is dry. Regular dental checkups are a vital aspect of dental care and treatment. The frequency of checkups varies from person to person in accord with their risk level, but visiting the dentist at least once a year is recommended.